So basically, when we talk about heart attack in young people, these things were happening even before. But the thing is, in the last 5 to 10 years, we have been seeing a very rapid increase in such numbers, especially around 2 to 3 years back when we started off in Jayadeva. We were seeing that when we compared these statistics to the statistics around 5 to 10 years back, we were seeing that the number of admissions with young age heart attack was almost like a 22% increase compared to some 10 years back. So that would mean that something has changed. Obviously, why would the rate increase to such an extent? So that is when we put our attention on this particular entity. And then what we did was that previously, individual patients of different ages would get admitted under different doctors in different hospitals. They would be treated as a heart attack, and that is it, and they would just go back home. But what we realized is that we need to see what is the reason why our society is, why this kind of an epidemic is rising in this society. So the best way to do that was that we started clubbing all these patients together. Having individual patients with different problems, you will not be able to get an entire picture. So what we did was we started something called as a Premature Heart Disease Clinic in 2017. So this clinic is where all these patients who come under the age of 40 years, who are admitted to our hospital with symptoms of heart attack. So all these patients are clubbed together, and we have formed something called as a Premature Heart Disease Clinic. So the advantage of this is that when we start clustering these patients, we get an idea of the nature of the disease. Like for instance, what we find is when we start clubbing all of them together, we saw that almost 25 to 35% of them did not have any risk factors, which is not the case in case of elders like 50 to 60, mature elders with heart attack. There we have a significant amount of risk factors, be it smoking, sugar, diabetes, hypertension, cholesterol. They are very common in the elderly age group. But in these younger patients, we started observing that a very significant number of them had none of these risk factors. And another thing is, even if, for that matter, if you consider obesity as a risk factor, hardly 23% of our patients of this entire group of premature heart attack patients, hardly 20% of them were seen to be either overweight or obese. So that means almost 75% of them were very much like one among us. They were very much normal with no risk factors or no diabetes, hypertension or any, and neither did they have any prior warning signs of a heart attack like a prior chest pain. It all happened all of a sudden, and probably some people would have even taken some extra time to realize that it was a heart attack symptom, and they end up landing very late in the institute. So this was the uniqueness which we were observing, and all this started only when we started clubbing these patients together. So once we got a clue about the nature of this particular disease and how it is spreading to such a great extent, especially we talk about Southeast Asian population, which basically deals with India, Pakistan, Sri Lanka, Nepal and surrounding areas. Even in the latest American Heart Association guidelines, it actually, when they have a particular risk scoring system where they calculate your risk of having a heart attack in the next 10 years. So even under this risk scoring system, they have a question called as the ethnicity. And in that ethnicity, the minute you put yourself as an Indian, your risk gets multiplied into 1.4 times. So it is not something which is a global phenomenon. It is something which only a particular population in this whole globe is suffering, and that is the Southeast Asian population. So the problem here was previously that we don't have too many of these research studies previously. We did not have, and a lot of our treatment and our management of patients and such diseases were based on guidelines given by the European Heart Association or the American Heart Association. We would be following guidelines from there. But then when we started studying this particular disease, we realized that a lot of the points which we get from the guidelines of these other societies of different parts of the world, they become kind of partially irrelevant to our population. There is something which is different which is happening in these population. So ultimately there comes the talk about prevention.